So, pharmaceuticals, being with oil and gas, we do something completely different, and this will not be a speak about what we are doing. This will be a speak about how what we have learned on our journey is informing the way that we are making business decisions today. And this is not just related to deciding, building on Peter's point, on the local context of water, where our production facilities should be going forward with the knowledge of water scarcity, but this is also getting to a stage where we will have to say what are the right questions we need to ask ourselves in terms of the products that we are developing. What are the expectations from our stakeholders, not just in terms of regulatory requirements, but what is also the limitations of the world that we will be doing our business in going forward. And for a pharmaceutical company, that is all about access, and it's all about not just the products that we are developing, but also the way that our products are being funded, and also how the demographics of the population of patients that we are serving is developing going forward. Not just in terms of numbers, which I can tell you for diabetes is ridiculously amount of people. WHO came out this week stating that it's a plague, not just an epidemic, but it is a plague. So you can say the market is developing around us, so what's the big hassle? But adding access is definitely a challenge to a modern insulin company like Novo Nordisk. We demerged back in 2000. We used to be both healthcare and enzymes, and we demerged back in 2000. And at that point of time, we had been working with environmental concerns. We had been working with employees, health and safety, but we decided that being demerged, it was important to keep these values as part of the fundament of who we were as a Novo Group, or the companies within the Novo Group. So therefore, we decided to follow the thinking around the triple bottom line, that making decision in an organization is all about considering both the financial but also the environmental and social considerations of the decision you're about to make. And this has been with us for quite some time. We have a CEO who definitely supports this. He's also measured upon it. So when I talk about integration, this is not just something in our annual report. It is also in our internal measurements, the balanced scorecard. It is also in the incentive structures of the organization. When you look at, since 2000, how the company has developed in terms of market value, it definitely gives a pretty neat picture. Novo Nordisk is the 7th biggest pharmaceutical or healthcare company in the world. And what I've added here to show how the company has developed, and I don't want to bring you into the thought of are we going to have a chicken and egg conversation, but just to show that some elements of what we have added in terms of sustainability throughout the journey has definitely helped us build the business that we are today. So back in 2000, just when Lars Rebien has been appointed CEO of the company, we had something on what we call the South African court case, which was about us wanting to protect the intellectual property rights of our products. It wasn't our products being in scope for this, but it was definitely being challenged on the whole HIV/AIDS epidemic in South Africa in terms of access to pharmaceutical products. So following the court case, the conversation internally in the organization was then, of course, so what does that mean to Novo Nordisk? What if it had been us being in the same situation? It was our products being challenged, not just the right to intellectual property rights, but it being our products. And based on that, we decided that we needed to do something called the World Diabetes Foundation, where which we have supported with more than 200 million DKKs since it was established. So this was our response, that we wanted to say there's something we can do as a business in terms of access and building healthcare infrastructure and building competences throughout the world. But there's also elements we can't link directly to a business, because then we will be blamed for you're earning money on on people being sick, and at the same time, how are you making sure that they do have access? So therefore, we created a foundation. But this does not mean that we are not building it into the way that we are running our business. There's a lot of other elements to this journey. One of the ones I want to highlight being here today is the climate target, because that also links back to the EPNL, the environmental profit and loss account we did. So back in early 2005, we decided that even though we have been working with energy efficiency in the company, we also needed to address the challenges by our stakeholders on how we were dealing with our CO2 emissions. We signed up to a target, we became a WWF Climate Savers company, and by 2010, and finally with the end of 2014, we had succeeded in achieving a more than a 40% reduction in our CO2 emissions. And at the same time, we had a return on investment on these energy efficiency investments of 2.1 years. We have saved operational costs of approximately 75 million DKKs a year, and we have invested around 125-50 million DKKs. But more importantly, it has influenced the way that we are now constructing our facilities. So when we do facilities throughout the world, we apply the same processes and the same methodology, but we have added that they have to be on water and energy even more efficient. And lately, we have also added that they have to be 100% based on renewable energy, local sourced, and if not available, then we will be buying certificates. So just to say, even though you're not within where people normally look when you talk about energy efficiency, energy and climate, we are also taking this upon us. That led to the conversation around environment in a greater perspective on Novo Nordisk, because this is all about the expectation, what we do within scope 1 and 2, and what we focus on as a company within our production processes. But applying data that came out of the EPNL, focusing on your full value chain, actually gave us data where you can say the sustainability people knew that our environmental footprint most likely would be bigger outside this organization, but it gave us the data to go to top management and say, okay, for years, when we talked about environment within Novo Nordisk, we looked at production and said, okay, we expect you will fix this because this is where we have our footprint. But the EPNL actually gave us some insights into both how much, if we were to be taxed on the, you can say, free resources that we right now are getting for society, what would the bill be? And I can tell you it was a 220 million euros in 2011, and that is approximately 10% of our profit that year. So it's not a small bill that we would have to pay or add to the prices of our products. And then again, it also showed us that it wasn't in production. That actually only accounted for 7% of our environmental footprint. Our biggest environmental footprint comes out of the way that we are spending our money. And if you start to generate data within each of your organization, focusing on how you're spending your money and how that is also creating environmental footprint, you will certainly get a completely different conversation in the organization and a bigger buy-in to some of the activities that you want to do in order to reduce your footprint in an organization. So when we talk about integration in Novo Nordisk, it is not just about the data and the performance. It's also about the thinking. It's also about how we engage with stakeholders. And the reason why I say you're the clever ones being here today is that where we seek the best knowledge or being challenged the most is when we engage with other industries or other types of stakeholders to Novo Nordisk than you would be traditionally engaging with. So we have conversation from the UN systems, but also into some of the more challenging NGOs, also to Novo Nordisk. We have also, we test our products, we are legally obliged to test our products on animals. I can tell you that gives you some certain sort of conversation, but we can also see that with the global goals being approved by the UN system, there's definitely things happening in the global governance setting that will be affecting us. So we are having conversation on all levels in order to fulfill our wish to integrate sustainability into how we run our business. Since this being a data session, I brought our annual report, We have an integrated annual report. We have been doing this since 2004. We are listed in Copenhagen and New York. That also means we are following Sarbanes-Oxley rules. We do that for all data being included in the annual report. But the most important element to the integrated reporting, and I'm not coming out of communication, I have to say, and I've been on the journey since we started doing this, is how you actually can use this as a tool for conversation within the company. As I mentioned the EP&L, the integrated report had also been a great vehicle or tool for having this conversation throughout the organization. How can you actually measure this? If you think of, normally when you talk about environment and health and safety, graphs have to go down. I tell you, when you start to have that conversation with corporate finance, they're like, but graphs going down, that is showing bad performance. We have to rethink and we have to communicate how we're actually improving, not just decreasing our footprint. And that sort of conversation, and also linking into then what measurements do we set in terms of long-term targets, suddenly becomes much more interesting. So we have the financial metrics, known by most, and then I wanted to just stop on one of the social metrics that we have, the one in the middle, which is all about patients reach with our diabetes care products. So we have a long-term target that we want to reach 40 million patients by 2020. Right now we are approximately 26 million patients, and we still have to do 14 million patients. But this is to some degree linked to the way, both how we are selling our product, which markets we are selling our products in, and what types of products that we are selling. So here you have an indicator which, just by the face value, you look at it, it is a social indicator. We put it in the social section of the report, but it is actually also linked to the way that we are developing our markets and the way that we are selling our products. So this is one of the outcomes of how we have been working with integrated reporting. And for being having the conversation around, will we be future fit? Will we be fit to deal with some of the global challenges that will be within diabetes care? So we are talking 40 million patients that we'll be reaching. We are covering half of the world's insulin production. There is an estimated 440 million people with diabetes in 2030. And there 40 million is not a lot. So do we have, as an organization, the baseline for starting to have the conversation? What does that mean in terms of how we're going to develop our business? And then the last slide, coming back to the whole Harvard Business Review and why we thought it was so significant. We were number 6 in the review on financial performance. There was another, it was an American company that was number 1 on financial performance. That company, or that CEO, was 87 in the total Harvard Business Review list, top 200 last year, because of ESG measurements. So the 20% difference, and they added 80% financial, 20% ESG, was actually what made the difference between good and great. So this is how we see we can be great and not just good as an organization dealing with some of the global challenges within our field. And this is how the journey that has been going on for the past 16 plus years had brought us to a place where data, metrics definitely means something. But if you don't add the ingredients of integration to the way you're thinking and the way that you're measuring, then for us, and I would imagine for many of you, it will not make the real difference from going from good to great. Thank you.